been a little while. It's a random night, Friday, 7:11. Cool time to get the podcast started tonight.
Oh,
And I've been in withdrawal of good conversation outside of like the normal 9 to 5 or the daily routine conversations that I have with colleagues. So I decided to kind of put the call out, and I one of my first outreach was to one of the hardest working people I know, somebody that I really get inspired by, Kasaya. You may have remember her from, gosh, about 20 episodes ago. She came on with her brother Nate and Ernest. We had a great conversation about some exciting things she's doing in healthcare industry, marketing, things like this. And
yes.
when I called her, she was like, "Oh man, you gotta get Tina." And I've been hearing about this Tina
Yes.
for, man, a year and a half. All great things, nothing bad,
Yeah.
but like this is this rock star person that you got to meet, Morales. And well, I guess we're gonna do that today, guys. So you guys are all lucky with me. I'm gonna bring in Kasaya
Amen. Yes, we are.
and Tina.
Tina's in the house.
So welcome, guys, to the podcast. Kasaya, you look like you're driving, so I'm gonna let you focus on
Sorry about
driving.
that, you guys.
But welcome again, and we'll talk about some of the exciting stuff that we've done uh, in the very recent past, starting with the kickoff of Kidney Month. But there's Tina, and Tina, could you tell us your full name?
Sure. Also, thanks for that intro. I don't know if I could live up to the hype, everybody, but my name is Bertina. Shout out to my
Bertina,
grandma. I was named
very
after my
nice.
grandmother, Bertina Denogene. And yes, my good friends, family and friends call me Tina or T or B. And I'm happy to be here. Good to see you,
Nice.
Kasaya, and nice to meet you, Michael.
Yeah, nice to meet you as well. So, tell me, how do you know Kasaya? Because it's one of those things like, if you're a friend of hers, you're a friend of mine, or I know that you're gonna, probably bite my head off because Kasaya is a killer out there when it comes to business dealings, in a good way. So, what's the relationship with you two guys in business and friendship, like sister and
Sure.
brothers?
Yep, like you said about 20 episodes ago, if you all remember, Kasaya brought in Nathaniel,
Hmm.
her younger brother. So I'm actually best friends with Nate.
Oh wow.
Um, so Nathaniel and I go back 20 plus years. And so when Nathaniel and Kasaya were living together in Long Beach, at that Coronado apartment, shout out to Coronado, that could be a whole episode in itself about
I
what went
bet.
down
I bet.
there, but a lot of fun times. I met Kasaya. And then, yeah, through the years, I mean, that's my extended family, my extended sis. And then when she started Direct Phil, Nate called me up, and these two brought me in, Nate and I, and family turned business partners, I guess. Would you
Kasaya,
say,
I think
Kasaya?
we might be getting feedback from your. Is it on your car phone? Got a little feedback when Tina was talking. Um,
Do you guys hear me? Do you guys hear me?
I hear you fine. Yep, but I got a
Yeah.
little.
So what Tina was saying is, so we go way back. So she's connected with my brother, my younger brother, 20 plus years. Um, going from my corporate kind of experience and background into my entrepreneurial life, Tina has been a very solid support system when it comes to sales and strategy, along with my brother Nate Nathaniel. And yeah, so that's how we kind of connected, was through just family and my brother, and then now more so through business in like, our company Direct Phil, and her just kind of like spearheading all of the sales initiatives. But
Well,
yeah, so
tell
a
us
little bit
about
about.
that really quick, because I mean,
Mhm.
that's kind of the foundation of current relationship, but it's got a long history behind it. Give us the abbreviated version, because it's been a while since we've talked about direct
Yeah.
feel and all the progress you've been making. But like sales, what do you mean sales? What kind of stuff are you guys working on? Let's talk in
Yeah.
today's date, because I know a year and a
Yeah.
half ago
Yeah.
was
So
something different.
Yeah, for sure. Thanks, Michael. So we originally originated to bring in nurses from the Philippines to the United States. So Tina, like myself, like my brother Nate, we're all Kalahate or half Filipina,
Mm,
half Filipino, half Filipina. So there's a bridge between who we are and then back to our home country, the Philippines. And so with that, we formulated direct bill with the advent and the precipice of bringing nurses from the Philippines to the United States. And so there's like an arduous process. There's a long vetted process from a legal and kind of like immigration USCIS process. And so we've since advanced from that, Michael. So now we're really a sales and marketing company where we
mhm.
deal in the area of like healthcare technology and education. And we provide staffing, we provide peptides, which is a big thing, and we provide BPO outsourcing. So, like call centers, back office billing, any kind of like back office services. And we bridge that from the US to the Philippines. And then for staffing, we bring folks from the Philippines here. And then when it comes to like marketing, we have a whole team here on the US that kind of supports that, as well as some onshore staffing. So we've kind of grown in the sense of like our portfolio offerings. And then Tina, since she's here, she spearheads all of our sales. So she's a national recognized sales. Is that right, Tina? Is that my saying right? Like she's a national recognized sales um, executive across the U.S. kind of marketplace sectors, specifically in healthcare, education as predominant, and then newly within the technology industries. And so we're leveraging her expertise, but she also happens to be a friend. um yeah, so that's where we've kind of advanced, Michael. Is so when we were talking before with Nate, it was like we were just focused on like nurses,
Mhm.
and then we realized that it's a pretty long process. So there's a huge need within the US marketplace to bring nurses here from anywhere, right?
Yeah.
Into the US health system. It's just hard. And so we have folks and partners that we're working with, but in the meantime, while we wait for the ability to bring in those skilled workers into the US health system, i.e., hospitals, um, we had to figure out a way where we could also support our vision and our core values, if you will, of providing necessary solutions to the areas in health, education, and technology that were the most hurting.
Yeah.
And so the most hurting were nurses, were teachers. Tina, and she can speak on this, has a very long history in decades of working with the U.S. education system. And so where what we do is really kind of like plug in like the holes where there's leaks in terms of like human resources for areas in the U.S. marketplace that are really sustaining kind of like the American population and like healthcare and education. And we provide, human workforce integration. And so that's where we've kind of like progressed, Michael, since the last time like you and I had talked, which was just nurses. And then now we've kind of moved into teachers. We've moved into like a full kind of portfolio of offerings.
Yeah, that
Um,
that makes sense. And congratulations on all the recent success. Looks like Richard Vanderplas. I'm not sure if you met Richard Vanderplas,
yeah, I remember
because
him from the
he,
last. Yeah,
yeah,
yeah.
he's on. He's on. But something clicked to me there that, and it's been, like I said, a year and a half. I saw you go into that journey, that gamble of starting a business.
Mm,
And then since then, it sounds like, I love that you mentioned vision and core values. And I just wanted to ask Tina, you've been there since day number one. So when you talk, uh, an original plan, right? A startup company, let's say, is that fair to say? Keziah,
mhm.
startup company,
Yeah, first
yeah,
starter for sure, for
yeah.
sure. Yeah,
So you
for
have a
sure.
startup company, and then you have that vision, you have a mission, you have core values, and then you find yourself in a place that, perhaps the original plan is not as quick to market. Um, in some cases we don't have the right plan in the beginning, right? But
Yeah.
talk to me about the pivot, Tina. Like, again, you've been there since day number one, so the pivot to say, like, we started with this, we're still doing this, we're still keeping the core values, we're still got the same vision and mission, but in the meantime, is it that we need to pay the bills? Is it that we have other things that our expertise can be lent to? Tell me about that.
Yeah, I would say a little bit of both, more so the latter, right? We do have other expertise and avenues and networks. I specifically remember the pivot vividly. Nathaniel and Kasaya came up to the Bay, so I currently reside in Oakland, and we had a whole day of strategy, just mind meld sessions, all of our offerings, which were all over the place, right? To Kasaya's point, where we started out as direct fill, healthcare solution, staffing, nurses, right? Coming to the US, when we put everything on the table, we realize, oh wow, we are much more than that. We are doing so much more. When we have, we have Dr. Brokerage, who Kasaya and him are partners, right? CEO, founded the
Mm-hmm.
company.
Mm-hmm.
You have Nate, expert in healthcare. You have myself, education and healthcare and marketing. And then we even think about like the creative bench of our networks that we have now. And we realized we went from, so it took a day when we were like, direct healthcare, right, solutions, almost pigeonholes, because we're actually direct fill providing solutions in
Mm-hmm.
so many different avenues. And when we got really clear on what those avenues are, which is again peptides, BPO services, staffing, right, nurses and teachers, that then came now revisiting our brand identity, who we are, tweaking our mission and vision, but like at the core, at the heart of it. And this is also why I joined the company, and followed Nathaniel and Kasaya like blindly, of course, with trust, because at the heart, just being able to provide jobs from folks from the motherland, number one, but number two, when we got our core values on paper, being just white glove curators, having a vibrant culture, we're fun, we're witty, we're smart, we work fast,
Mm-hmm.
and just being able to provide a meaningful service, to folks, and being a global entity to folks in the US, that then brings our family,
Yeah.
jobs here. It all just kind of gelled. Did I miss anything, Kasaya? Around like, and that was in September, I want to say the pivot was.
Yeah. So yeah, that's so I was like I was talking about that, Tina, to someone, and I was like, I feel like Directville was like rebirthed in September in that moment up in Oakland. Because anyone who's listening, it's one thing to like, no offense, and Michael, you can cut me off at any time. Like for
I'll
my
edit
like
you. I
my
won't cut you off.
my whole career has been like working for other people, and I won't go into like who and the what's and
Mm-hmm.
whatever. But I've worked for some pretty big companies, and I've done some pretty cool things in my career for other large large like Fortune 500 companies. And when Direct Fill was formed, we were kind of like on the precipice above, like, let's bring nurses because there's a huge deficit in the US marketplace in the 16,000 hospitals that exist, not including urgent cares, where they need nurses, right? And then there's like the skilled nursing facilities, so there's ancillary services, custodial care that need nurses, right? And there's just the fact of the matter is there's just not people going into the profession. It's like teachers, because we also provide teachers.
Mm-hmm.
So we were like, oh, let's like fulfill a need, right? And then there's the whole process of working with like USCIS, immigration. There's a lot of, I won't say red tape, but there's just like a long, laborious process to get into the United States. But once you're here and you go through the process, like you get in, it's really great. And so there's like beauty in that.
Yeah.
And so we were beeline for just like nurses. And then we realized, ooh, this is really hard. So we opened up our portfolio of like things. It's really based upon like the people that we know in our network. And we're like, what does our network need? Who are industry partners? And then what can we do to structure things that create value in the marketplace
Mm-hmm.
to solve solutions. So at the end of the day, it's great to make money, 100%. It's great to um, close a deal, to solution a problem. And so we're really lasered in on, you know, helping the healthcare system, helping the education system, helping companies do better when it comes to workforce. And so we've spent the better part of a year. So we're kind of like new as of September, like we kind of rebranded. We've been out there to Tina's point, but it's been like over a year and a half to your point, Michael, where we've been out there like just trying to figure it out. And like you and I, Michael, I'll just be like real, like we were working on some initiatives in the beginning, right, to bring nurses here,
Yep.
because for anyone that's listening, at, as of 2025, the U.S. is in a deficit of 450,000 nurses, and that's just the facts, right? And
Mm-hmm.
so the average age of a nurse in the U.S. healthcare system is 43 years old. So, like, pretty young, you know, like, but it's if you look at like from a workforce like analytics perspective, it's actually it's pretty it's an aged population, so there's not a lot of people going into the field,
Yeah.
and the amount of patients that are in terms of denominator that are being generated is pretty high. And so it's like, what's the solution? So there's a lot of stuff that happens in geopolitics, in
Mm-hmm.
things that are being discussed right now on CNN, for example. But at the end of the
Yeah, we
day,
got
you have to
somebody
look.
asking about this basically,
Oh
uh,
yeah, I
and
would
and
love
and
to
I,
answer.
and I want to save that question for a second because as you're talking, I can't help but just wonder, Tina. So Kasaya is a CEO founder and co-founder with Dr. Brokerage, right? Is that right?
Hmm. Yeah,
Um,
yeah. So we co-founded Direct Fill together. He's
yeah,
the clinical, yeah, and co-founder, and then I kind of operate the company. Yeah,
yeah.
yeah. And
So
then Tina heads sales, so she's the one who knows the marketplace. So she's the person to talk to when it comes to understanding the needs of the marketplace. Yeah.
I'm more interested in just kind of some emotion here. Uh, so a need to pivot, right? A need to pivot. Like I know what it feels like to own a company, right? And I know what it feels like to, not saying this was your case, but I know what it's like to fail.
Mm,
I know what it's like
yeah,
to
we
go like,
failed.
oh man,
Yeah.
I went off the cliff. I ran the
Hmm.
car off the cliff. Can I salvage this car? I know what that feels like as a business owner. I don't know what it feels like from the angle of having to pivot as somebody that's working within the company and
Mhm.
Mm,
just I know that you're diehard because I just even without meeting you before, from what Kasaya tells me, and then the different sort of posts. I follow you guys. I stalk you guys, right? Social media. But I see just the attitude, and it's all upbeat, and I gotta say, like, I admire Kasaya, the just your forward motion, and then you've got people on your team that are also in forward motion, despite, like, a pivot is not a forward motion, right? A pivot is like sometimes going backwards. So Tina, like, can you talk a little bit about that? Not so much the details of like what's going on in there, but as a professional, as an executive, like, what does it feel like? What are some of the emotions? What are some of the challenges? What are some of the strengths that maybe you bring into this equation to be able to muster the storm, or weather the
Yeah.
storm, I guess it's called, right?
Yeah, I love this question, and a lot of people will probably say it's us failing forward. I like to look at it as building the plane while we're flying it,
Yeah,
and
yeah.
I live for this stuff. I
Mm,
mean, throw me like I'm an innovator, I'm a creator, I'll pilot anything, I'll try anything on. If something fails, I'll quickly bounce back just with I believe in the power of not just hard work and grit, but positivity.
mm,
I thrive in sunshine and rainbows. So when we're thinking about weathering the storm, feeling down, XYZ, I'm there for a second, but
mhm,
then I pick myself back up. And what makes me feel truly grateful is I was brought in at the ground level,
Yeah.
right? To
Yeah.
support, yes, sales, but also business development of the company. So even having a seat at the table to just ideate, strategize, and help with the pivot,
Mm.
that meant a lot to me as well. So Kasaya is such a great leader in the sense of like the culture that she's building, we're all building together. So for me personally, I don't know if Nathaniel would say anything different because he keeps us grounded. But for me, I'm like, this is my shit. Like I thrive in what's not working so we can figure it out and what's new and innovative. Is
No,
that helpful?
yeah,
Yeah.
absolutely. I think that that gives tools from two sides. You know, attitude, perception. You know, okay, I'm gonna let myself be down for an hour, and then I'm gonna get my ass going. That
Yeah.
kind of attitude. But then, you know, the way you edify Kasaya in the culture that she's building. I mean, Kasaya, are you that good? Like you like you know you like what is the foundation of like a high functioning team? What's the foundation of Maslow's hierarchy of needs? I mean, self actualization is
Yeah.
at the top, but there's like this need for trust, which obviously you've got there. This, you know, at the ground level part of the solution, not being given a solution per se, but being a part of the solution. You know, are you that good that you got that figured out? And before you answer that, what does productive conflict look like for you guys?
Yeah, so to answer your latter question first in terms of like what productive conflict looks like is, so we're a startup. We are literally grassroots building this. We've been really blessed and grateful. It's been a lot of work, and Tina, from Oakland till now, like we've been working on clients to close deals, and we closed 2 deals last week, and
Congrats!
then we
I
have
saw that.
others coming on. Yeah, thank you. It's it's been a process of evolution. So um I wouldn't say, oh, am I like such this great leader? So this is what I'll say. I'll say this. I've been through shit.
Mhm.
So I've been through corporate America, which is one thing. I've been through startup investing and companies that have like a lot of valuation and PE, kind of private equity investment, and then I get shares or some kind of like, share kind of thing. And you work really hard. I've worked my ass off with not getting paid,
Yeah.
and then hoping that I would get paid because of like some kind of share buyout in terms of like, in the tech industry, and then not getting paid.
Mm.
And so that developed a a mindset where I was giving my all in the hopes of what the founders had told me, and that they would pay me, and then they didn't.
Oh, that's
And
crazy.
so,
You
yeah,
say it's
I've gone
crazy.
through that.
I've been there too. But yeah, I say it's
Yeah.
crazy because it is crazy, right? Like,
And it's crazy and it's hard. And you know that,
have you seen
Michael,
him in
when
a
you
dark
look
alley
back, you're
yet?
like, yeah, yeah, I would love to see them in a dark alley, but it's like my nature is like, let's get some neutrality here. But on that point, like I either had to think in that moment and say, like, man, they're a bunch of like terrible people, and just kind of put it on them, or I had to own my moment in time
Mm.
and say, oh wow, I kind of believe them, and I did a bunch of like free work for a long time hoping for a payout, and I didn't get anything. I
Yeah,
actually ended up more in the hole than I expected
I feel you.
in my life. And then owning that moment. And so with direct fill, I think what Tina's talking about is, I don't want at all that to be our culture. So we're a startup and we're looking for like revenue. We have some clients, and my goal was, and has been, and executed this week, which is such a blessing, was I'm going to pay them first before I pay me, because I know what it
That's the
feels
way
like to
that
work.
That's the way that one goes. It's good call, Kasaya. Looks like we got you froze up on us, Kasaya. So
Yes, she is that good.
she is that good. Tell me, Tina, though. You know, is that the secret sauce? Is are some of the things that Kasaya mentioned some of the secret sauce there? Let me pull her off.
Yeah, I would say so. And then even just looking at the chats around just the foundation being the key words. Shout out to Richard for saying that.
Mm-hmm.
Just coming in with a foundation of trust and rapport, and that takes a while to build. So again, noting we were a little ahead of the curve because, like I said, Nathaniel and I, 20 plus years of friendship.
Mm-hmm.
Kasaya, my extended sister, and then Nate and Kasaya, brother and sister. So that made coming to the table for us to be super open,
Yeah.
transparent, get gritty, just get real, and have healthy conflict, right? To
Mm-hmm.
that's the foundation to really trust each other in looking at each other's blind spots or really trusting in, oh wow, that is a great idea, even though it didn't come from me, him, or her, you know? So
There's
yeah, I'd say
Kasaya
so.
again. So yeah, I agreed
Yeah,
that.
sorry about that. Yeah.
No worries. The healthy
I
conflict.
ran
We were
out of
at healthy
battery. Yeah.
conflict, Kasaya, and Tina says that there's plenty of that. Tina, how are you doing on time check?
Yep, I got 3 minutes, and then you're gonna have to have me back. We need a part two because I'm
Yeah.
having too much fun.
Yeah,
I
we
don't want
needed
to
a
leave.
part two. Can I
I
say
have three
something,
minutes.
Michael? Because like
Shoot.
it's really important, like as founders, like yourself, like Tina, she's also done like a bunch of shit and like coaching and all that stuff. It's like when you've gone through those moments, it's like when you get anything where you can give your team or the people that have supported you, you fucking like, sorry, am I allowed to, like,
Of
you do
course.
it. You know what I mean? Like it was, for me, it was like I want to give them the reward first because
Yeah.
I know what it feels like. And it sounds like you too, Michael, like where you're giving your all and you don't get anything. And I just don't want that culture in my company. I do not at all,
Yeah.
you know?
I feel you.
And yeah, yeah.
Tina, what do you think? Give your all. I mean, does it always come immediately? Are you somebody that's patient for the treasure in heaven type of person?
I mean, yeah, what do we say, Kasaya? It's already done. We we
Yeah,
we are
it's already
we
done.
love to live into the vortex. So, if you're big on manifesting the universe, Abraham Hicks, Jerry Hicks, shout out to them.
Mm-hmm.
Just writing our goals and dreams into fruition.
Yeah.
So we're already living the end game. That's why we celebrate in the funness and the grit, and the money will come. Like we're just having fun building what's ours, our own, quote unquote. We're not working for the man anymore.
Yeah.
Well,
Yeah.
Kasaya, you're the man, but you know what I'm saying. We're building this together.
No,
Oh
I'm
shit! You got a new title. You're the man.
no, I'm not.
The
There's a
man.
man.
No, it's been
Yeah.
really great meeting you, Tina, and I want to respect your time. Can you give us, because I can't remember it off the top of my head, but I just don't want to mess it up. What's your Instagram and your different handles? I feel like it was pretty cool.
Oh yeah. Sure, sure, sure. So you can follow us at Direct Phil. Shout out to Michael Morales, who is stalking us and promotes us. Also follow him back as well.
Mm-hmm.
But that's the company handle, Direct Phil. And then my personal Instagram, which is also public. I do a lot of outward facing stuff. My day to day, I'm in education. Obviously, Direct Phil is my number one right now. I'm an avid golfer, and just a little bit more about me there. And this is going to tell a lot about me with my handle. It's Tabasco,
Tabasco.
like the hot sauce,
Yeah.
Tabasco
Yeah.
underscore time. My favorite hot sauce. I put Tabasco on everything. But yeah, and thanks for the shout out, the follow. I look forward to coming back on and spending a little bit more time with y'all.
Yeah. Look forward to a face to face next time you're in the Long
Yeah,
Beach area, and we get to
let's
hang out
do
a
it.
little bit with Kasaya and maybe Ernest and Nate.
I'm there.
Yeah.
Yep. Long Beach
All
is my
right.
old stomping grounds. Shout out to SoCal. You all have fun. I'll talk
Yeah.
to you
Thanks,
soon.
Kasaya. How are you on time? You want to go through a couple questions that we've got for you?
Yeah, I have a couple more minutes, Michael.
All right. So I want to let me switch the view on this really quick.
But Michael, like in the meantime, like it sounds like you feel me when it comes to like you've gone through the process and like the whole structure of like when folks are like, hey, they keep you going, they're not paying you,
Many
and
times.
they give you like the goal.
Yeah.
and then you're like, oh shit, like that didn't happen.
Yeah.
Like,
Many times I could say that, you know, those sort of experiences are, they outweigh the good ones. Like the bad experiences outweigh the good ones. And, uh, some of them you learn lessons and kind of put up this wall. And
hmm,
I've been in that position where it's like, no, I'm not going to do anything for free, you know,
mm-hmm.
but here I am, I'm 47 years old and I still do a lot of stuff for free.
Yeah, same. I
Um,
do a lot of stuff for free. Yeah.
yeah. So I think, having, when you look at a project, when you look at a potential partnership, when you look at a new business, sometimes you're like, especially when you're bootstrapping,
Mm-hmm.
you take rides with people, right?
Mm-hmm.
And it's like Tina said, I don't know, she said building the car, building the plane when it's flying, right? It's
Yeah,
already
building
flying.
the plane while you're flying it. Yeah.
Yeah. And I don't know. When I hear that term, I kind of think like build the plane, why, who's flying it?
Wait. Yeah.
While you're
Well,
flying it or while I'm flying it?
yeah.
uh
So I think of it. Yeah, I think of it as like I'm flying the plane, but I'm also building it.
so I
It's
guess, I'm going to put myself in Tina's shoes, you know. I'm not sure like how you're, and not the discussion that I was looking for, but when we look at a founder, owner, uh, nobody will work as hard as you will for your company, right?
correct.
Nobody will.
Mm-hmm.
But
Mm-hmm.
sometimes people will get in that plane with you while it's
Yeah.
flying, and it's like there's not
Correct.
much there. And I've done that so many times, so many times. Um, there are times when you do that and you might be getting paid. There are times when you do that because you say, when the plane is built, we'll all get something out of this, right? So I've been
Yeah.
through both of those, and I think that it's given me times where I'm on defense, and I'm kind of against that sort of thing. But then I realized that, especially in the thing that I'm most passionate about, healthcare and nephrology, that if I wasn't doing things out of my heart, um, what's the right way to say this? Like, I will do things out of my heart, not just because it's going to line my pocket. Uh, that's probably, again, more the case than not the case. So yeah, so Richard's saying she needs to hear our story. Young and, what does it say? Young Michael to now with me. Uh, Richard, I can send you a link if you want to jump in with us. Just let me know. But I want to hit the
Well, Mike.
question that he asked. Go ahead, because I.
Mhm. No, because I was gonna say like when you have people like Tina or like Nate, my brother, and we have like a couple other people, which is exciting, that have kind of been integrated into the direct fill world. But when you see their passion and their belief in the vision and the mission of what you're building,
Mm,
for me, it makes it easy to say, oh, okay, like let me do this. Yeah, for the overall mission, but for them.
mm,
Because I've been in the position many times where it's easy to, and this is going to be very like, it's not going to be, P&L. It's not going to be finance. It's not going to be like budget and all that stuff, which we think about as owners, business owners, and founders.
yeah,
It's just going to be like real life where it's like you have people like Tina. She didn't have to get on this live, you
yeah,
know,
yeah,
and she did. And she believes in the company because there's a vision, and it's above money. It's about being part of something, and the other folks that are involved in direct field, it's the same thing. And I think, I, I don't think I know, like in life now, we're so connected digitally that we're also not connected like humanly. And
yeah.
so when you create a connection with people, they like press into that. And then if you're a person who's like a leader, for example, founder, what have you, and you're building something to give value to people, and you're willing to take the punches because there's a lot of punches, I think people respond to that. That's what I've noticed. I am
Mm,
eternally grateful to like Tina, Nate, and a couple others that are like joining on, like Brandon, who wasn't able to join in.
Mm-hmm.
And they want to be a part of something, and they want to be connected, and they want to be a part of a solution, and they want someone that can lead that and take the hard hits and make the decisions. That's what I've seen, and it's not easy, and for me, I'm just saying this one last thing, I'll be quiet.
No, you don't
uh,
you can't be quiet because I'm the only other person here with you. So,
oh, I
uh,
thought I thought Richard was there.
we'll
So
see.
I'll say
I
this
gave him
one
a
thing.
link.
So a lot of folks will see me and they'll say, "Oh man, like she's new. It's easy, right?" Not knowing like my career has been latent with like challenge in a good way.
Yeah.
It's whether when I was in the corporate life, I had to prove myself, and then when I went into the entrepreneurial life, I had to prove myself. And even before I went into direct fill, I was doing my flower business to figure out like what am I doing, and I was scrubbing buckets in the studio and and figuring it out. And it's about the hustle, it's about the grit, it's about like the grind, it's about believing in what you're doing, it's about the passion, and things do follow. Is what I've noticed is when you put that energy in towards whatever it is that you're trying to produce and generate, like the world follows, and that's what we're seeing. And it's just, you got to be really true to the people that follow you, like Tina, Nate, Brandon, for example, who wasn't able to join. Like, they're so supportive of the direct fill mission, and I'm eternally grateful for them. Sometimes I'm like, oh man, like wow, they really believe in this. Is so awesome, and it pushes me to do more, you
Yeah.
know.
Yeah.
Yeah.
Richard Vanderplas,
Oh,
the
Richard,
Yeah, I
hey
just want to.
the
I
Richard.
the
just.
legend. Oh
I,
my God.
I love her
Oh God.
passion and.
Oh. Oh.
Oh my god.
Whoa.
Yeah. All right. I
Well,
don't know
this
what's
is
wrong with these
actually
people.
close to my anniversary of 45 years in the industry. So there you
Hmm.
go.
45 years in what
Oh,
industry, Richard? For
congratulations.
those of you who
That's
don't,
awesome.
Yeah.
those who don't know
Yeah,
you,
Dialysis.
congratulations, Richard.
dialysis. Yeah.
Thank you.
Yep.
Thank you. It was. I love your energy. I love your passion. I put a couple questions in there, and I know you have to go soon. So Michael invited me in real quick. We're
So he's
going to
like, hurry
Vegas
up and
next
answer
week.
them.
So
What are your questions though, Michael? What are your, or excuse me, Richard, what are your questions? I'm just
no, I
curious.
was just curious about, bringing in all the nurses, the teachers, the dut, dut, dut. So the new administration has made it a little challenging on some
Oh,
of
I love
the.
this. I love it.
So my question
I'm
to you
interested
was,
as
with the
well.
change, you pivoted in September, and now you're pivoting in January because you have to deal with the O1s, H1 2, all the visas that you have to deal with to try to get people in to work. That was my question to you, because that's a challenge that you didn't want to even deal with. You're just trying to get people in, and now you have to pivot now.
Right. So so there's a couple, like, Richard, can I respond to your kind of question?
Sure.
Cool. So we'll start with nurses. So nurses typically come on an H1B. There's
Right.
other EB3. Some people have talked about TN. Michael knows about this. That's really not viable, but by and large, it's an H1B. So in the U.S., there's about like 65,000 H1Bs. It's almost a lottery that are allotted per annum across all industries.
Mhm.
73% of that 65,000 is typically allotted towards the tech industry, and like engineering kind of jobs or whatever the case may be. And the rest is kind of like across everything. So nurses have priority, but with this new administration, interestingly, they actually support the H1B visa for teachers, for nurses, and for technology kind of designations in terms of like job title. They actually support it now. So we're waiting to see how that kind of transpires over the next like 30 days.
Hmm.
If it's going to be an easier pathway. So the denominator of how many visas they allow, the 65,000, for example, maybe they'll increase it. That's not really of interest to us. It's more of how easy is it, how much easier it is in terms of like the timeline to get the nurse here. So with teachers, it's actually a J1 visa, which is about a 3 month process versus the H1B, which is about a year. We're hoping that the H1B with this new administration, that 1 year, it's about 12 to 18 months at the most, that it gets shortened in terms of pathways because of the designation of a nurse, because there's a huge deficit of nurses in the United States by the end of 2025. So December, right before New Year's, we'll be in a deficit of about a little over 400,000 nurses in the United States, just because people aren't going into nursing, other nurses are going into other avenues. And so this new administration has had a lot of headlines, if you will. But one thing that they do advocate for is the H-1B visa. So in the next 30 days, we'll see what does that mean for nurses, right? So
But
again, per annum, USCIS typically grants about 65,000 visas H-1B per annum across all industries. But if there's certain uh, cap exempt, if you will, so meaning like they don't have, you can get a visa and not be included in that denominator of 65,000 if you're a nurse who applies and gets a visa sponsorship from a teaching hospital or a nonprofit. So they're outside of the 65,000. And that's always been the case. With the teachers, it's a J1V. It's a little bit easier. I think the barrier to consider is the deconstructing of the Department of Education,
right, I was going to ask about
on
that.
a federal level, but there actually poses some opportunities because each state, so it makes it hard for agencies, right? Because they kind of have to think. It's kind of like if you're familiar with like Medi-Cal and Medicaid, every system in every state
Richard's
has
like,
its
don't talk
own.
about that.
Yeah, it's like every state and every system has its own kind of like structure and way of doing things. So that's what's going to happen potentially with like education and teachers. But there's an opportunity there where each state can then become its own like have its own autonomy to regulate its own kind of like decisions and how many educators that they need and the rules of the, for bringing in educators instead of it being like an overarching federal thing. But it's kind of a little bit of like a wild west right now. So it has, to your point, Richard, it's put a perspective with direct fill with our agencies and our partners for bringing nurses and teachers, because we talk to them like every other day. It's made it a little bit more nuanced, if you will, on how we get those folks here into the United States and immigrate them on a temporary visa, potentially into a long-term type of situation with a green card, which I think is great. um, I am a huge supporter of that. Um, and so I think over the next 30 days, we're kind of going to learn a lot. Um, but it hasn't really like dissuaded us. It's only pushed us further because at the end of the day, you need nurses and you need teachers. Do you have them now? No.
Well, you know,
So what are you going to do?
I gotta say that, the similar questions like on my mind in many discussions, not just about immigration and, where we're gonna lie with the current administration, maybe especially initial days, because it kind of seems like there's, a lot being done that will take a little bit of time to get through. And hopefully we get through it and we're in a better place. But even things like tariffs and medical device manufacturing, the cost of
Mm.
care, it all kind of to me feels like a flip of the coin at the moment. But I got to throw something out there to both of you that
No,
when
Mike, Michael, before you go there real quick, can I jump in?
yeah, yeah, shoot.
Just so you know, I happen to know immigration attorney that helps all the Lakers, the Dodgers, all the sports, all
Hmm.
the people that go to the ski resorts from Switzerland. So you have a resource here that I know somebody that's a little high level that works on this stuff all the time. So my
Mm-hmm.
sister-in-law and my good friend are longtime attorneys in LA. So if you need help, let me know.
Oh, thank you.
Anyway, go ahead, Michael.
So
Yeah, thank you,
so
Richard. That's
I
awesome.
I ran into the craziest thing the other day. Um, you know, helping some friends. I have a heart for the Philippines as well, not because I'm Filipino, but I'm born in, or not born in, married in
Yeah.
to the culture, and have partners and friends in the Philippines, and uh, I was helping out with something, and I was like, hey, check this nurse out, right? Thinking about her for this specific project, and I saw on her resume that she's in the Philippines, but she's a nurse in the U.S. And I said, what the, I'm trying to figure this out. And then I kind of read through a little bit more. Have you heard about these robots in the facilities, like a Temi robot? Have you guys heard of this?
No.
So, I mean, I guess it's kind of like the roll around translator type of thing, but it's a tele connection from a nurse overseas. In this case, it was the Philippines, that is an NCLEX passer and actually acting as a nurse in a United States facility, helping with care plan, care communication, things like this. I thought it was the craziest thing. And it was, in our realm, Richard, of, chronic outpatient dialysis. It, from her mouth, it kind of freed up the staff in the facility to go about the things that, as Kasaya is explaining, like we're pretty damn short staffed from a nursing perspective. We're also pretty damn short staffed even in dialysis clinics from dialysis technician perspective. If you were to look across the nation at the top two companies, there's more than enough jobs out there for a lot of people that are looking to come into an entry level healthcare position. But have you seen much of this? The overseas nurse that is acting in place of they're NCLEX passers, U.S. NCLEX passers, but they're overseas and they're operating from a tele perspective. Richard?
I haven't seen it, but with the administration and their new policies, they're forcing stuff to not come in the country because they want it to be made here.
Yeah,
And
yeah,
being made, I'm talking about nurses
manufacturing.
being trained here,
Oh,
people
yeah.
being hired, pushing education towards that. It's going to take a while to do that. Obviously, it's not going to happen overnight. It's going to take a long time to do
Seems like
that.
such a
But
soft band-aid though. I mean, Kasai said there's 400,000, if
450,000 by the end of this year of a deficit of um of nurses. Teachers, it's about 356,000 in a deficit, specifically in the areas of STEM, science, technology, engineering, math in the United States. People just aren't, at the end of the day, it's very simple. They're not trying to become a nurse and they're not trying to become a teacher.
yeah.
So our population in the US is at a loss for that. So how do you address that is augmentation through immigration
What do
in
you think
foreign
about
marketplaces.
the what do you think about that remote type of worker though? I mean, a
I
lot of a
I
lot of us
mean,
have overseas workers, right? Call centers, customer
right.
representatives, things like this, whether it's from
Yeah.
India, from Philippines, other countries.
I,
What do you
yeah,
think
and I
about that
love
for
this
nursing?
and I love this point. Well, I think from a review perspective of kind of looking at the patient's chart,
Yeah.
of kind of orders on what needs to be done in terms of a practical application. If you have a charge nurse from a remote place, I think that's great.
Mhm.
I love technology. My background has been in AI and technology for the better part of 20 plus years. So I'm a huge advocate of it. And especially if you can create a global landscape for it and a global economy, I'm all for it. So,
Yeah.
and if it's helping the US population in terms of the areas that we have deficiencies, like in health, like care and
Mhm.
education, by all means. So, as long as that the use case and the application of how the nurse from the Philippines, the NCLEX RN, for example, is reviewing the data in the patient's chart, and if they're providing kind of insights into the care pathway of the said patient,
Mhm.
or I don't know how they would be helping the patient. if they're helping them in any way in terms of care pathways, in terms of outcomes, in terms of edifying what the doctor needs to know, I'm all for it. I think that would be great. I think it's a great use case that's probably going to be like blown up, you know. Um, but into Richard's point, in terms of the current administration, what I've seen in the in so like BPO, right, business
Yeah.
process outsourcing and like call centers and stuff like that,
Mm-hmm.
and like Michael and I have some common business associates in that area that kind of delve in that area. People will say
You
whether
want to
it's
say
this
hi to them or
administration.
what?
Yeah, hey, what's up, Tuan?
What's up, Tuan?
Um, what's up, Tuan? What's up, ETC?
He was on a
Out in the
minute ago. I know
Philippines.
that for
Yeah,
sure.
we
So
love you.
make him blush.
Um,
Make him blush now. Like we
yeah,
recognize you,
he's
Tuan.
also he's like golfing right now.
Yeah.
Um, like what time is it in the Philippines? He's golfing.
Yeah.
But at the end of the day, people will say if the administration's like, yeah, they want to build manufacturing jobs, like tangible jobs, like production. Really, they want to generate widgets here from resources from here. And they want to have a job, a person that's generating widget here on
Mm-hmm,
our
mm-hmm.
soil. That's 100% I'm for. It's great. I love it. But it's not going to negate outsourcing because at the end of the day, companies need to make margin and there's
Yeah.
operating costs for certain types of services and jobs that can be done by a skilled worker overseas for a less cost. End of story. And companies are doing it. I talk to them all the time, and they can have a workforce here and they can manufacture here and they can have materials and everything and their widgets created here while certain back office things, if you will, and calls or whatever, like the Tuan and his company are supporting and servicing, are done overseas to support a global economy at a lesser cost. That's okay. And so I don't think this current administration is against that. They're just focused on bringing production back here, which is also an opportunity for us to ensure that more of the back office skills are being outsourced elsewhere at a lower cost because it brings a benefit to the bottom line and internal operating income IOI
Yeah.
for the businesses, and it makes their profitability like go up because they have certain things that can be, jobs, if you will, job codes that can be outsourced overseas.
Yeah. Thoughts,
I
Richard?
haven't seen I haven't seen anyone really shy away from outsourcing. Everyone outsources at the end of the day.
Right.
Yeah.
No, I agree,
Yeah.
but I think there's a certain aspect to outsourcing that I wrote an article, I don't know, 15 years ago, how
Oh,
technology has hurt patient care.
I was thinking about that
And
when I saw the robot thing, Richard.
and because you physically can't look at a person when you're even like looking at a person through a camera, you can't really see them. You can't physically touch them and feel that they're clammy or feel that they have some skin issue or feel like there's something going on internally.
Mm-hmm.
And now with technology, I don't have to go see my patient for 3 hours because everything's being recorded.
Right.
So I could just walk away, hook them up, walk away. In our industry, we can just walk away. We don't even need to worry about anything. Everything's being recorded. All the values, blood pressures, temperatures, everything is being recorded. So I just feel I just miss that human interaction. There's a point that we always need that
I love
human,
this.
yeah,
I love it.
and I think there's a place for technologies, but there's also a place for human interaction.
Yes.
You meet somebody like I'm gonna bring it to another level. Like, look, I'm gonna meet you on the internet. Oh, let's go dating. Like you see everything I'm putting online. You
Yeah.
haven't you don't even know me from a can of paint,
Catfish.
but you're
You're a
going off of
catfish,
what I
man.
put on the internet.
Yeah.
And
Easy to
until
get
you
lured in.
physically get to see that person and touch that person and get to really see their interaction, technology can't replace. I mean, that is the core of what we are as humans
Mm-hmm.
and caretakers. So
Yeah,
You
and I go ahead, Michael.
go ahead because I'm gonna kind of shift modes here in a second.
Okay, because I want to say one thing, and I have about like 5 more minutes, if
Okay.
that's okay.
Yeah,
So,
I was trying to respect her time.
no, thank you. So, Richard, I want to say like one thing. So, you jumped in when I was on a pod with Michael at his like pod studio, and you're so awesome. I love your perspective because you're provocative, and it's great
Ooh.
because it makes people think. Um, I am 100% in support of what you're saying in the human interaction. So I'm someone who's spent over a decade developing, building use cases, and overseeing teams that develop like advanced cognitive AI in the healthcare industry. And for UHG, for Optum, billions of dollars that they've made off of those use cases, and white papers that have been written off of the things that myself, my colleagues have done. So, all that to say, what that made us see was how important human interaction is. So, this is kind of like a funny example, but like there's like the Starbucks effect. I don't know if you've heard of it, where if you're in like a town and there's like a local coffee shop and then a Starbucks opens up next door, it draws a lot of customers, but it forces people to make a decision to go either corporate or to the small business. And then the small business, the old school coffee shop, actually benefits from that whole kind of like corporate
Yeah.
like presence, because people are like now wanting to either, they want to enforce the fact of like small business and this kind of like, more natural experience of interaction of like buying coffee and supporting like the small guy in the town, right, versus going corporate. So I
Yeah,
feel like,
you're too young to remember this, but that's like the Cheers effect.
oh, what's that? Oh, what's that?
Everybody gets to know that, Cheers was a show back in
Yeah,
the
yeah,
day that
yeah,
everybody
yeah,
knows your name and they got to, they know everything
yeah.
about you. They get to know who you are. Starbucks doesn't give a damn.
They don't care. And so some people are like, well, today I don't really care if someone knows my name, so I just need a coffee.
Yeah.
But they know in their heart, in the human experience. And so I feel like, and this is anecdotal, okay? But keep in mind, I've spent over 10 years developing like advanced AI. And I won't go into like my background and credentials and everything and who I've worked with. But
You
I
just
do
sounded
know
scary, Kasaya. That kind
some
of scared
things.
me.
No,
Oh
I've
no.
worked with like the godfather of like machine learning, like
Shit.
PhD. He's out there. So like in his like out in Austin. But what it so like I also have my flower business. Michael knows about this. Like I'm a floral designer, right? And people are like, why the hell would you do that? And I was like, because I realized how beautiful, simple, organic things are, like humans.
Mm-hmm.
And so we're in this age of like information and AI and everything's at our fingertips. But so we desperately, to your point of Cheers, we want human interaction. And there's something to say about that. So people are going to see that, they're going to productize it, and they're going to monopolize it. It's just how human nature is,
Yeah.
right? But there is things that are going to be digitized within the patient, like physician interaction, within value-based care, whatever the case may be, nephrology, that's going to advance the experience for the patient, and I don't want to take that away. But there's also, we're on this cusp of like, we're realizing we really want human interaction, and I feel like people are going to want that fee for service like experience where the doctor comes to their home with the bag
Yeah,
and
that's been
does.
a big buildup for quite a few years now.
Yeah,
Yeah.
because they
Yeah.
don't want to just go telehealth because it's easy, but when push comes to shove and life happens and you're like, freaking A, like I just want an interaction, that's going to happen. So I feel like the human experience, quote me on this, is going to elevate in the next decade.
Yeah.
No, I agree. And I'll give you a real quick example before Michael jumps in is that literally today I got our compliance report from our company. So I looked through it. There's one physician that hasn't seen his patients for 8 weeks,
Oof.
but
Like
he gets
physically
everything
hasn't seen
on
them.
physically has not saw them eye to eye in 8 weeks. They're
Mm-hmm.
complaining to us, but he's continuing to chart. He's continuing because he sees everything
virtually.
online. He
Yeah.
sees everything
Mhm.
through telehealth. He sees every so he and they're pissed off like everybody else has a doctor coming in and seeing me or a PA or an NP or a nurse and but because he can get everything he needs, he doesn't feel like he needs to come in and that's not the right like I said, I feel there's a place with AI. I feel there's a place with technology, but never forget these are human beings that need to see somebody
Mm.
Yeah.
eye to eye.
Yeah.
Yep. Love
Hey,
it.
Kasaya, before you jump,
Yeah.
it's March
I
28th.
love this, by the way. I love this whole topic because it is actually very near and dear to me because I've spent so much time in it. I believe in the human experience. I believe in human interaction. I believe it is above everything else. Um,
Well, come to
and we,
Vegas next
we,
week. Mike
yeah,
and I will be there in
I know.
Vegas. Just
And
come.
we
Well,
forgot. It's just we forgot because of all these fancy tools.
Whatever. Just get it. Hop on a flight. I don't want to
Yeah.
hear.
well,
Just
that I kind of
come.
Yeah.
wanted to go
I
there.
love it. I
I
love,
wanted to
I
go there
always
a little
love
bit
what you
because
put
I
down, Richard.
Richard.
Yeah.
So we, Richard and I, we've been seeing each other in these things for next week. We're going to see each other in Las Vegas for this nephrology conference, right? And oh man, this might rub some
Whatever, Michael.
yeah,
Like you never done it before, so
yeah,
just
might rub some feathers or whatever, ruffle some feathers or whatever you call it, right? uh I've been going to these things for, like I said, 20 years or so, to these conferences, and I've learned a lot. We talked about network tonight, and how what people know of you, and some people might say who you know, but I think really what people know of you, how it lends towards your future, right? You have this Rolodex, Tina has this Rolodex, Richard has this Rolodex that tomorrow is just an issue is just a phone call away, a text away, right? So I think there's a lot of value in these professional conferences, these networking type of events. But I got to say that I've been really wanting to have a, a, a first podcast here with somebody. We just set it up last weekend. I'm in withdrawal, and the reason why I'm in withdrawal is because I learned so much. I've learned so much since I started the podcast. It's been a year and a half now, and I feel like the people and the conversations I've had in the podcast, and then what happens after the podcast, has taught me more than I've learned in 20 years of all the conferences combined. Like sitting down with people and, across the desk or even like this, and just getting, a one-on-one story or a group discussion, just open, productive type of conflict. So we kicked off Kidney Month together, Keziah, March
Hmm.
1st.
Hmm.
We have a mutual friend that actually I met on the podcast named Justin Pham, and we really wanted to find a way to share Justin's story, and we started to talk to each other, just different friends, and Kasaya jumped in and she was like, I got you. How can I help? So we threw this little art show. We had, I don't know, maybe about
it was a
100 people in
little
the
art show. It
room.
was a big art show, but
It was,
okay,
yeah, it
whatever.
was, I mean, it was a great, great group of people.
I
And
think it
when we
was like
talk about
70 people. Yeah,
that, were in the
maybe.
room at about a time, yeah, about 70,
Yeah.
about 100 rolled through the doors that night.
Right. Yeah.
Small blank space, event center. Kasaya did a bunch of decoration for the place, made it look beautiful. And kind of like the last week, I was like, Kasaya, can you MC? And she was like, boom, I got it. And man, she killed it. She killed it. It's
Yeah.
like she's a professional MC or something like this, right?
I just like talking to people.
But exactly. There was a lot of talking. There was artwork to look at. There was a little bit of an agenda that Kasaya, had to kind of rush through because it was packed full of different people that were sharing their stories. And I don't know, was it about 10 people, Kasaya, that shared their
Uh,
stories?
yeah. Like in the evening was about it was about 10 people that shared from yeah, from their own transplant experience to um, advances in synthetic kidneys. Yeah.
Yeah, we talked about transplant, living donation, transplant recipients. Um, Justin Pham, our good friend, who
Yeah,
is
such a good person.
looking for a
Gosh.
kidney today, guys.
Yeah.
We were highlighting his story, but he said, guys, this is not my story. This is our story. Not meaning everybody in that room, but the 90,000 plus people that are waiting for a transplant. So I just wanted to kind of, I've been wanting to recap this month that we kicked it off with so much learning, that human contact. Kasaya, could you say anything about, because you were there and I know that you're not like in the nephrology space, but since kind of getting introduced to it or maybe more exposed to it, you've said it to me that's kind of smacking you in the face all over the place now. So what was the experience with that art show? What were your takeaways? Did you take any actions? And then I'll share a little bit about what some of the actions were after that show.
Y- Yeah, so I took some personal actions to kind of outreach to people and organizations that are involved in the nephrology, or really, it's really honestly, Michael and Richard, just kidney transplant. So I reached out to a couple people. I actually met with one of the gentlemen who was from Moderna
Mm-hmm.
and that was supporting, I think, the Kidney Foundation.
Yep.
And I was like, how can, it's just kind of figuring out, it's just how it is in the world of business. Like, how can we bridge like ways for us to figure out ways that we can help people get like live kidney donors?
Mm-hmm.
So my focus walking away from that is how can I be more of an active advocate towards live kidney donation? Because what I've learned from the folks that are on dialysis or waiting for a kidney is, man, they're so courageous.
Yeah.
So every day it's like we wake up and we have, our goals and stuff in life, and maybe we have a bad day and we're sick with the flu, but like they're constantly like just pressed with what they're going through in terms of their health condition every day, and yet they still fight forward and they don't want that condition to define them, and that really touched me. So I walked away from that. It was like, how can I be more involved with advocating and supporting like live kidney, like a live donor, if you will.
Mm-hmm. Mm-hmm.
And then my focus, just because, like, Michael, you've introduced me to him, is Justin,
Mm-hmm.
and Justin Pham is like, I really want to see in this year, like him get like a kidney donor.
So do I.
Yeah.
Let's help him
And
out,
it will
guys.
happen. It's going to happen,
You
you
know,
know?
the crazy thing, just kind of a side note to all of what you guys are talking about, is that years ago, California put in the helmet law. You know what that hurt?
Mm.
Mm-mm.
Kidney transplants.
Mm-hmm.
Oh, because
Because
less
when
people
they weren't
passed?
wearing helmets, they were brain dead. So then they were able to give up the organs.
Yeah.
California put in the helmet law, so they weren't brain dead anymore. So the organs stopped.
Not as
Oh.
many organs. Yeah. Yeah.
So it was just a had nothing to do with what we do as an industry, but it affected us greatly because, and God forbid, I'm not trying to be morbid, but
Yeah.
No, love it.
the,
Yeah, it's
That's
life.
deep. So just to kind of go back to some of the, I guess, the response and the actions from that show. We had Kasaya as an MC. We had a dietitian named Jonathan Diaz that gave a few minutes on kind of how to keep healthy. Maybe some small changes you can make in diet to keep yourself from hopefully far away from type 2 diabetes and high blood pressure, which leads are the top two leading causes of chronic kidney disease. We had people from the National Kidney Foundation, Amy Hewitt, who actually donated her kidney. She's a living donor
Yeah,
and gave her
yeah,
testimony
she's
there.
cool.
We
Yeah.
had the president of the UKRO, Lewis Kleinberg, who taught us a little bit about some of the research that's going on with synthetic and stem cell populated kidneys that, has a very exciting future. We had a transplant recipient, Walid Hamdard, who's also a living transplant recipient and also currently a dialysis technician. We had
Also, Jimmy was alive.
Jimmy
He was a
Kinson, right? So
yeah.
the artist that you guys got to look up, Jim Q Arts. He's colorblind and he's like a badass oil painter. I
Mm-hmm.
mean, like realism, Richard. You got to see his painting; they're beautiful.
all right.
And his testimony is just incredible. Then we had Mark Coronel, who a lot of you may know. Pretty well known kidney fighter. They call him. He's just shy of a professional boxer, and he found out he had kidney failure when he thought he was healthy as hell. He had a rare kidney disease. So we had then Justin Pham, who was the muse. of the show, and he gave his story. He's still ongoing. He's on peritoneal dialysis, and the artwork that was displayed was mainly kind of like the day in the life of Justin while he's connected to that machine in the morning and going through his morning routine. So, what was the response? We had many people there that were dialysis patients themselves, the families of dialysis patients, or maybe just learning about kidney disease, kidney illnesses like Kasaya. And within the week after that, I had several emails from people who had registered in the health app on their iPhone and with the DMV for Donate Life to become
Oh, that's
kidney, or I should say, organ and tissue donors, which, man, that helps more people than we think, right? You know, what's the exact number? I don't know, but it could be up to 100 people that could have their lives improved, saved, some healing um, through donation of organ and tissue. About a week and a half later, Mark calls me up, Mark Coronel, and says, "Hey, I got a friend. He needs to tell a story. He's CKD4. He's progressing quickly. He's on the transplant list. And tomorrow, I want to say what's up to Mark and to Big Sleeps. Big Sleeps is a very well-known Los Angeles lettering artist, tattoo artist. He's a great guy, great family man, and he's put out a recent plea for his life. So if you look up Big Sleeps on Instagram, you'll see some documentary that was shot recently. And then tomorrow between 2 to 6 p.m., just again look up Big Sleeps. You'll find the the information about a really cool art show that's happening in Los Angeles. I'll be there. Hopefully I'll see some of you all there. I think there's a story to be told there. But Richard, I'm going to see you next week. We're going to be at one of the professional shows.
Well, we're going to try to get her to fly in. It's just a flight away. Just
Richard.
Send
I,
me the details. I'll see if I can make it work.
Richard will send you
well, we
the
can get you.
ticket.
I'll send you a plane ticket. Yeah.
I all right. So
Richard, I love your passion. Sorry, Michael,
Look,
because
I've been doing this. I've been doing this a long time, and there's a story between me and Michael, and I said it in the comments about a young Michael to today has completely changed, and he is he is one of these dudes that went from basically being an asshole and didn't know what the hell he was doing, and I
to
love him
covering
to
it up
death,
good
but
now.
yeah, but but basically he's somebody I look up to now. I've done a lot, but
same.
he's out there
I
pounding the
appreciate
pavement,
that
and
about you.
I'm too old to be doing it
Well,
anymore.
this is a great group here. I meant it because I earlier when I thought about like let's get on a podcast. Few people I reached out to, very few, and
Thank
both of you
you.
are in that group. But I'm at this point where I need this constant stimulation from like somebody to inspire, and
Yeah,
watching what you're doing right now, Richard, watching what you've done over the last 4 decades, and you're continuing to do. It's like what you said, because I had the passion,
yeah,
purpose driven. We all want to be successful, but I think we all have a deeper purpose than individual success, which is really really I think a bonding trait between all of us here.
absolutely. 100%.
So I do
One.
want to. I know you got to go, Kasaya. Um, so want to thank you for introducing me to Tina, and look forward to
Yes,
continuing that discussion. Hopefully, we can do it
she's
in the
awesome.
studio. Get
Yep.
together in the studio. Richard, I'm sure we'll get the chance to maybe shoot some
Yeah, we'll
content
definitely
next week.
catch up next week. Absolutely.
Yep, we'll be at the Juice Bar.
Yeah,
uh,
whichever one we find. I don't.
or the GNC, right?
This
Richard, we'll be at
this
the
is a
GNC.
this is a new hotel for us, so I'm not sure where I'm going to end up.
Yeah, well, looking forward to it. We'll be at the Planet
Yep.
Hollywood,
Oh,
April
nice.
1st
Oh,
through
nice.
4th.
That's gonna be fun.
Yeah, it's the
Well, but
National
you
Association of Nephrology Technicians annual symposium. So it's a
Oh,
four-day deal.
send her the information. You have her email. Just send it
Yep.
to her.
Yeah, I'll send it over.
I may pop up, Richard, and we're gonna have a
Don't
discussion.
don't threaten me with a good time.
All
All
right,
right,
guys. I
guys.
have to go.
Yeah.
Michael,
Okay.
thank
Now
you
I want to thank both
so
of our
much.
guests
Richard,
and
you're awesome. I appreciate you guys
Kasaya
very
So are
much.
you.
handles. Where can people reach you at?
Oh,
Give us.
so directfill.com. So ka@directfill.com or @directfill.com. Or hit up Michael and he'll route you to me. Sorry, Michael.
And what about your socials? Like how to like because I want people to be able
Yeah,
to.
so Direct Fill, Petals and Pricklies. Hit me up on any of those handles. So I'm also creative in that I do floral design, and I've done floral design for many cool people and events. And then I have Direct Fill, which we've talked about, in integrating needed workforce and solutions in the marketplace with specifically in health and tech, so and
Could
education.
give
So
us give us
it's
I
at
love I
Direct
love
maybe
the
Fill,
pet
Richard.
the yeah.
Direct, but it's FIL with one L, like Phil Am. So it's a
Yeah,
play on Filipino
Filipino.
American.
Yeah.
So it's Direct Fill, yeah, or Petals and Pricklies. So
I was going to
Kasaya,
say
give us a
petals and
sign out.
pricklies is kind of an interesting. Yeah, it's that's a little
I
prickly and petals are soft. So you go on one side or
yeah.
the other. It's like
Yeah,
sweet
see,
and
you caught
salty.
that, Richard,
It's
where it's like it's beautiful, but it will
but
prick
yeah, it
you.
could be a
could be
little prickly
painful.
if
Just
you
like
want to.
life.
Yeah,
Could be painful, right? Kasaya,
Yeah, it's
give us
so
a sign
such is
out.
life.
Give us some wisdom before you go, Kasaya. An
Gosh, I don't
entrepreneur fighting the fight every day. Every day is not a winning day, but you don't get to the winning day if you don't keep chopping away, right? So give us something along those lines.
I think in I think any entrepreneur goes through dark moments and know that I have gone through them myself, but know that they are not here to stay and that if you continue, things do work out. And be very mindful of who you surround yourself with.
Hmm.
Yeah.
That's that one. That's
Yep.
what Richard tells me sometimes. That one.
Yep.
Richard,
And
yeah.
don't
I'm
be
give
afraid
always
us
to
like,
draw the line.
give
yeah.
us
Don't be
the.
afraid
We
to
have
draw the line.
Don't be
It will
afraid.
be in your best interest
Yeah,
to draw the line of who you surround yourself with, and it will help catapult you forward. Yeah.
agreed. Richard,
and,
give us
and life
similar
is
advice.
short. Live every minute for what it is. Tomorrow's never promised. So
And yeah.
There you go. Well, for joining us, I want to thank Kasai Abanyal, Richard Vanderplas, Morales. I'll see you guys on the next one. Take care,
Thank you
everybody.
guys.
Bye bye.
all right. Bye bye.